Most people have heard of LDL cholesterol and HDL cholesterol. Those are the cholesterol types that people commonly refer to as the good cholesterol and the bad cholesterol. But did you know that even if your cholesterol levels are normal, you can still be at risk for heart disease and stroke? That is because there is another cholesterol particle that you need to be aware of and that you need to follow. That is the lipoprotein a. Lipoprotein a can be described as an LDL molecule with an extra protein attached to it. That extra protein is the apolipoprotein a. The apolipoprotein a can cause inflammation in the body. Now, lipoprotein a also contains regular cholesterol. The result is the molecule, the lipoprotein a, that can damage the body in two fashions. First, it contains cholesterol, which we know can build up in the arteries and lead to plaque formation. Then it has the apolipoprotein molecule that can cause inflammation in the vessel wall. And the inflammation in the vessel wall can lead to rupture of plaques and to heart attacks and strokes. In fact, that is the most common way heart attacks occur. Exactly how lipoprotein a increases the risk of heart attacks and strokes is still not known. Lipoprotein a is similar in structure to a substance in the blood that dissolves clots. That substance is called plasminogen. Scientists believe that lipoprotein a interferes with the function of plasminogen, and that makes our blood prone to clotting. Now, unlike regular cholesterol levels that can be lowered by lifestyle changes, lipoprotein a is not affected by these. Stress management, a heart-healthy diet, regular exercise, blood pressure control, weight loss will not lower your lipoprotein a levels. This is because 70 to 90% of your lipoprotein a levels are inherited. On top of that, there still are no good medications to lower lipoprotein a levels. So what can you do if you receive a report and your lipoprotein a levels are high? The regular cholesterol lowering medications that we're familiar with will not lower lipoprotein a levels, but they are beneficial. They can lower the overall cardiovascular risk. Doctors will therefore optimize your cardiovascular risk by prescribing a statin. The next step is to maximize your overall cardiovascular health through rigorous lifestyle changes that include heart-healthy diets, regular exercise, 150 minutes of aerobic exercise weekly, smoking cessation, weight control, blood pressure control, and, of course, if you're diabetic, diabetes control. Checking lipoprotein a levels are very important for people with premature heart disease or with a family history of premature heart disease. That is, if you or a family member had heart disease or stroke before the age of 55 in men or 65 in women. People who have hard-to-treat cholesterol are on maximum cholesterol medication and their cholesterol levels are not lowering or not descending, should also have their lipoprotein a checked. And you should have your family members checked too. Elevated lipoprotein a levels run in families. The good news is that there are ongoing trials right now with promising medications that will lower the lipoprotein delay in the future. I hope you found this video useful. If you did, like and share with friends and family. You can support this channel by subscribing. Until the next video, stay healthy and stay safe.